Good Saturday morning to you, and welcome to the all-new Sleep Show. This is one of the most fascinating subjects that has been brought to my attention in quite some time. Having a problem sleeping could be one of many, many reasons.
So I'm a dentist that practices in Burlington, Connecticut, and one of my specialties is TMJ and sleep breathing disorders. Sleep apnea in particular. Mm-hmm. I don't know how much you want me to say.
Your name.
Oh, yeah. I'm Dr. Bethany Brenner.
There you go. That's introducing yourself. Dr. Bethany Brenner. Tell me a little bit about you.
So,
how did you get into this?
Well, first of all, how did I get into dentistry?
I want to know it all. How did you get into dentistry, and then how did you focus a little bit on sleep, too?
Yeah, so I started off, I was a good student in high school, and I wanted to be a nurse. And my dad says, well, if you're smart enough to be the doctor, why be the nurse? And I'm like, I don't know any women doctors. And he's like, well, you could be the first. And so we got talking about medicine, and I was like, they don't really have a life. They don't get to sleep. And sleep was really important to me. So he had me go across the street and talk to a dentist who I didn't know was fairly well-renowned in Hartford, he's since passed away. Oh. But Henry talked to me for 2 hours and said, I think you're going to make a fabulous dentist. And I'm like, and what do I need to do? I was 15 years old.
Oh, wow.
Okay. He said, you need to get good grades, you need to take these sciences, and you need to talk to the dental school. I'm like, oh, who do I talk to over there? He said, well, you go in and you talk to the dean of students. So I did that. I went over there. And they said, make sure you take these college courses and so on. And when I applied, because I finished college in 3 years. I know.
Wow.
That was a feat. I took
Incredible.
20 hours a semester and had good grades. And so I was in the first wave of acceptance, and they didn't take a lot of ladies in those days. We had, I think, 6 women in our first class. So anyway, so that's how I got into dental school, and I loved every minute of it. I thought, this is my world. I absolutely adore being a dentist. And I always thought, if you can't do this well, then you need to get out, right? And I love patients. I love dealing with them. I feel like I'm Sherlock Holmes. I'm a good diagnostician. And so people come to me from all over when they can't get their problems solved with the dentist that they're seeing. So I give them advice. Sometimes we send them back. And I get calls from all over the country. It's very interesting, which is why I can't give my time away anymore, because sometimes I really feel bad for these people because they're in a pickle. Anyway, so I got started because my brother called me one day and he goes, I just put my CPAP in the closet. And I'm like, okay, I didn't know you had sleep apnea. He goes, well, he said, I can't wear the thing. He said, I got it because I was snoring, and I still snore with the CPAP on. I said, okay. He goes, you need to fix me. I said, Jeff, I don't do this. I'm not trained in this. And that's exactly what he said. And so I ended up saying, oh, give me a little bit of time, because I have to find a residency. I have to find some people who are doing this. And I only like to train with the best people in the country. So I found a program. I went through that. And then since then, I've actually done some other residencies. But they didn't have a formal residency from dental schools at that time. There was no dental school that ran a program. There was no residency that said that.
Tufts? Isn't Tufts a big dental school?
They didn't have a program.
Wow.
So they do now,
Right.
I believe. They have some. But there are other independent groups that have done training. So I am qualified with the American Academy of Dental Sleep Medicine. I didn't finish to do their board certification, so just let everybody know that, because it was a political thing. I'm just going to say that, and I thought, okay, you just want my money, right? So I've studied with many people who I think are really top in the field, and I'm a voracious reader, and I live on PubMed. Sometimes I'm like, how many more articles can I read? But this is a fascinating subject matter, and when you start getting into the depth of it, you realize how complicated it really is.
All right. A couple of quick questions, and then we're going to get into a little bit more in depth. One has to do with dentistry. One has to do with sleep. Okay, As far as the dentistry is concerned, I read a study probably a few years ago that one of the top 3 fears that people have? Death, that's more the unknown. Public speaking, and the dentist. And I'm like, why are people so fearful of dentists?
My take on it is that they don't know what's coming. So one of the fears that you have is the unknown, and you can't see in your mouth while they're working on you. So imagine sitting there with your mouth open and you can't see what's coming at you because it comes from the side oftentimes. Dentists never talk to their patients to tell them what was going to happen. And so all of a sudden you have a stimulation or a uncomfortable sensation, but you don't know what that is. You don't know if it's going to get worse, right? So right there they go, stop, right?
Yeah.
So one of the things you do is you give control back to the patient. So that's what I do.
Oh, my goodness.
So I tell them what it's going to smell like, what it's going to sound like, what it's going to feel like. Because high-speed drills and slow-speed drills have different sounds. And when I explain it to children, I'm like, okay, this one's going to sound like a whistle.
Oh, my goodness. You do kids, too?
I do kids.
Oh!
And one of the things that I say with the slow speed is going to sound like a motorcycle. Vroom, vroom, right? So you get these sounds, and so they know what's coming. Oh, it's going to vibrate. You're going to feel it bump on your tooth, right? They do fine. And so I have a lot of people who've had very bad childhood experiences. And so they were like, if I raise my hand, are you going to stop? Well, they test you, so you have to stop, right? Because I want that trust. I want them to know they're going to be okay. And after they do that a couple of times, then they know I'm going to stop. And so they're like, oh, okay. And pretty soon, I mean, I have people that have moved away from Burlington, moved down to Danbury, sometimes in another state like Massachusetts, and they still come back to see me. I had one young man he and his family lived in Harwinton, which is the town next to Burlington, and his mother died suddenly with a brain aneurysm right before Christmas. It was very sad, right? There are 4 kids, and he was the oldest. He was in college, so, and I got to see the whole family, and Dad brought everybody to me, and it was like I became the new mom. Anyway, long story, but he ended up moving to Rhode Island, to Providence, and he always came back to see me. I said, it's a 2-hour drive from Providence to Burlington. I said, there are good dentists in Providence.
I would hope.
And he's like, but I only trust you.
Oh, my goodness.
You see,
does that warm your heart?
It totally does. And I have them call me. I've had kids call me from Korea. I have a broken tooth. I don't know if this dentist knows what he's doing. And so I'm like, well, where did he go to school? And I started saying, these are the questions you want to ask. Then the dentist gets on the phone. So he and I go back. I get back on the phone with this young man, and I'm like, he'll be fine. He went to the United States dental school. He's good. I had a young man from Spain that called me one time. I had a woman who was traveling in Italy, and she called me. So you have to, there's this, I'm an information source. I'm a resource for you at all times, no matter where you move to.
The other question that I had, like I told you, this one has to do more with sleep. I once got into an argument a few years ago about the amount of hours of sleep a person needs. Because I get up very early, and interestingly enough, I go to bed very late. I probably go to bed around 11:30.
Oh.
And I get up at 4:30.
Oh, you don't get enough sleep.
But I do that, with the exception of the weekends, I do that every day because I have to be on the air at 6 in the morning, but I got to be here at 5:30. Yeah. So there's not many people on the road at that time. I miss all that morning traffic.
Right.
And I don't live too far from the studio. My point is, I've been getting 5 hours of sleep every night for a long time. I've asked that question to other people. The only answer that I received, that I want to get your answer to this, is, well, different people have different requirements and what they need. Because I had always heard like 7 to 8 hours. I'm like, you've got to be kidding me.
Actually, it's more like 7 to 9.
7 to 9 hours.
Yeah, exactly.
I got things I got to do.
So, have you tried to go to bed earlier? Or you can't go to sleep?
No, I'll be like, my mind will race. I've got things I've got to do. My mind will start going, tomorrow I got this and I've got that.
Okay, so you need to start earlier to wind down.
Yeah, well.
There are things that you can take, and oftentimes people don't realize blue light affects them.
Yeah, okay? I heard that.
And I have some that take melatonin and think that's going to be the cure, and it's not.
I think that upset my stomach.
Well, melatonin they like to take right before they go to bed because they think it's going to help their sleep. That's not the time to take melatonin. The time to take melatonin is at dinner time.
Oh, look at this.
So it's understanding the supplements, and what you're doing is you're creating more cortisol in your blood system because you're not getting enough sleep. So what does that do to you? That puts you in the state of fight or flight, which we like to call sympathetic, and you're not over in parasympathetic, which is rest, relax, and heal. Your body needs to heal, and your body goes through these flushes. They have a brain flush at night, and if you don't get through the brain flush, you're not taking the toxins out of your brain. So that affects you. Now, that accumulates over time. So people start to get, I'm going to call foggy. They say, I can't remember things. I'm getting more foggy. I'm kind of tired. Right? But they don't attribute to anything. So what do? They eat more sugar in the morning to wake them up because sugar wakes you up.
Well, put sugar in coffee, but I don't really,
It wakes you up. The caffeine also helps you.
Well, yeah, I thought it was the caffeine.
But if you're drinking 5 cups of coffee in the morning, that's way too much.
Oh, no.
Okay, so that's my point. You just where's the balance? What I typically see, and I'm going to call you a short sleeper, because you really need to be in that sweet zone of 7 to 9. When you sleep more and your body heals better, you rebuild the system more efficiently, and you'll have more energy. You will find that you won't carry as much weight. You'll lose weight more easily. There's a lot of other funny things that go on when you don't get enough
Fascinating.
sleep. Oh, yeah. That's
on
why
weekends, when I don't have to get up early to come here,
yeah.
My body will just, I don't even set the alarm. I do during the week,
Yep.
but so I'll sleep like an extra maybe hour, but that's it. I'm like, you got to be kidding me. I can sleep for another 2 hours. No.
So I go to bed at the same time.
Every night, no matter what?
Pretty much, unless I have an event that I have no control over.
Right.
You know those things. I try to go to bed at the same time, and I wake up at the same time. All right, that's our circadian rhythm, because our body is like, you teach yourself how to sleep. So when people have to start sleeping more hours, I'm like, okay, you got to start earlier in the evening. You got to start getting away from the blue light, the computers, the cell phones, the iPads, and you got to start. Right. This is the winding down process, right? So that when you lay into bed, your brain is now ready to go into delta state where you're going to sleep.
Boy, if this is a precursor for what's to come in this show, yeah. I am super excited. I've heard of a term, and I'm sure you're very familiar with, sleep apnea. All right. What exactly is sleep apnea? I've heard of it. I think you stop breathing or something? I guess that's all I know. You're the doctor.
So sleep apnea is exactly that. We count when we do a sleep study, okay? It says we have different devices that can test your sleep. I like to use something called a ring, which slides on your finger. No wires, no gizzy stuff on your chest, no belts, no wires down your arm, on a finger, in your nose, taped onto your face, because a lot of the physicians, they're still using what they call a home sleep test. Oh. Mine's a home sleep test, and it gets all of the same information.
That'll keep you awake.
Well, a lot of people get panic attacks when they put this stuff on, and they can't sleep, all right? So we use a ring. It slides onto your finger. It Bluetooths to your smartphone. And we then say, turn it on when you're getting into bed and turn it off when you're getting out of bed. And the interesting part is that it's very easy to do. So we can actually do it on 3-year-olds and up.
Outstanding. What a lesson this is.
So when we test that, now so to get back to your original question of sleep apnea, it's a count of how long you hold your breath. If you hold your breath over 10 seconds, it's counted as a sleep apnea event. How many?
But you're not even conscious of this.
Oh, no. You're sleeping through the whole thing.
Right.
Your brain is not aware of what you're doing at all because you went to sleep. So the only thing that's functioning is the essential centers of your brain to keep you breathing. Okay? So the conscious level went to sleep with you.
Do CPAPs work for everybody?
No. They have improved them. They used to be very noisy, and they now have something called an auto-PAP. The auto-PAP they've improved them, so they're a little quieter. They now have them almost the tubing's coming off the top of your head so you can kind of roll from side to side. But not all technicians are really wonderful at helping people with these solutions. Typically, when they wear a full face mask, when they blow so hard, it starts to flop on the skin and it wakes you up. We have people that end up with, they put it on their nose. They call them nose pillows, and they end up breathing through their mouth. I have some people on full face masks that they do pretty well until their nose gets more clogged up, and well, that's a whole nother reason why you don't sleep well. But when it blows too hard in the nose, it comes out the mouth, and so their mouth is open, their mouth gets dried out, and they hate the mask, and they end up ripping it off in the middle of the night because they can't sleep. So compliance with CPAP is difficult, and the physicians know this, but this is considered the gold standard, right? Everything compares to what you would do on a CPAP. So,
Yeah, let me do a quick ID here. I have a follow-up question to that. Folks, you are listening to The Sleep Show along with Dr. Bethany Brenner. I'm Gary Byron. 860-673-7155. Again, it's 860-673-7155 and online at theburlingtondentist.com. A MAD device. You've heard of this, MAD?
yeah.
What exactly is that?
Well, it's an orthotic appliance that we use for sleep, but I personally don't like them because they create a lot of TMJ problems. So when we talked about TMJ, that's obviously the joint or the hinge of the jaw, right? So when they do, I like to say to my patients, when they make you look like Jay Leno, your jaw's really stuck out really far. And we know that creates some problems with the musculature that controls the jaw. The dentists have been told for over 20 years, just tell the patient it's better that they don't die and they wear this appliance. And so it's okay if it screws up your jaw. And it does over time. So we have many people that end up with a lot of problems with their jaw joints, and their bite is shifted, and they can't chew properly, and there's all this stuff that they have to do after they wear these devices. Now, I've testified before the Dental Commission here in Connecticut, and I said, really, we need to be more careful about these things. But there are dentists out there that they make you the appliance, and they go, I'm done, see ya. Almost like the sleep technicians do with the CPAP. Here's your appliance. I've told you how to use it. See ya. Only call me if it stops working, right? So
your own.
Do you ever see the sleep physician again? The answer is no. Okay. Do they test you again in 10 years? The answer is no. So I have a different take on it. So my feeling is that we can find that sweet spot where you need to be to get you from sympathetic to parasympathetic. And I have a computer program that helps me figure that out.
Oh, my goodness.
So I test everybody so that I can get you into that sweet spot. And it does not mean that your jaw is sticking out like a Jay Leno.
Okay, there are symptoms, I would imagine, of sleep apnea, and I'm sure there's several. Can you go into a few?
Well, now that's a really complicated question. Because
well, we got 7 minutes?
So most people come to me because their face hurts.
Oh.
Okay? They don't come to me because they're sleeping poorly. I know. Interesting, right?
Yeah, you lost me on that one. Wow.
So why do they do that? Why does their face hurt? So that's my job, right? So I have some people, it's like, well, I'm grinding and clenching my teeth. Okay. Oh. So I tell them, if you lifted a weight and you trying to get your bicep bigger, right, and you're doing this all night long, do you think that muscle might be sore?
You think?
So,
yeah.
And that's what I say to them. So you're working your jaw all night long, right? So that's just one symptom. A lot of people get headaches. Why do they get headaches? Because they've been holding their breath for over a minute and their oxygen desaturating. And now when I look at their desaturation, if they fall below 90%, and we tend to breathe air right around 97 to 98%, most adults. So if you're now desaturating, meaning you can't get enough oxygen, guess what happens to you?
Yeah.
You get headaches. You wake up with a headache. You don't know why you're waking up with a headache. You feel tired. And here's the worst part. I start to see people develop dementia.
Oh, my goodness.
So one of my patients was a premier IT person here in Hartford, and she was 62 years old. and she was having problems, but she struggled to follow the instructions to do the sleep test. Okay? So we put it in bigger font. We thought maybe that was the issue because she probably got her glasses off while she's trying to go to bed. And we finally got her to do the sleep study, and she comes in we're going to review the sleep study and talk about options. And she goes, I've just been diagnosed with dementia. And I said, oh, my word. And she's like, I don't know what I'm going to do. I mean, she was still working. She was struggling. So I hear these sad stories, and I don't want that to happen to anybody.
My goodness.
But that's a concern. And you don't know if you're doing that because some people, and especially men, don't get headaches. Okay? Neck pain is another big one, right? Shoulder and neck pain. And you think, why? Right? So it has to do with how you breathe. There's a lot, there's so much more that goes into this. So I wake up a lot to go to the bathroom. So you say,
that's an aging thing, I would think, right?
Nope, it's not an aging thing. I have young people, and I say, how many times do you get up to go? And so I just had a woman this week, and she goes, well, I get up at least 3 or 4 times a night. I go, that's not normal.
Wow.
Okay, once maybe, okay? So why does that happen?
Is once normal?
It can be, but there's, it depends on the day. Did you completely, void?
Did you drink a bottle of water right before you went to bed?
Exactly. So people often say to me, I stopped drinking fluids in the evening because I have to get up so many times at night. And I said, and how's that working for you? Because they still get up. So then the men think it's a prostate issue.
Yeah, a little Flomax will help them with that, right?
And they're taking that, right? And I said, that helping you? No, that's not helping either. So they come in and they're on a boatload of medications because nobody's really asking the right questions. That's my take on it, anyway. So you just need to look at all parameters.
That's all right.
So anyway.
Wow.
But yeah, so we talk about that. I had a man who said, he was a very Indian, very smart guy working for Pratt & Whitney, and he is a great individual. And I said to him, so when you tell me you get up occasionally at night, how often is that? He goes, every hour. And I said...
That's not good sleep. That's disruptive.
Exactly. And so this is why when you have fragmentation during your sleeping time that kicks you out of the deep sleep that you're trying to get so your body repairs, right? Is that one of the things that's keep kicking you out is that you have to go and get up? So not always, but a sleep apneic event is also a fragmentation of your sleep. So every time you have that, sometimes it takes you out of a deeper sleep into a lighter sleep. You don't wake up fully, but you're already having a problem.
Wow. Oh, my goodness. So as a dentist, what should a dentist and maybe even other professionals look for to help screen for possible sleep apnea?
Well, my hygienist does that with every patient that comes in. So we're checking your blood pressure because that's also an indicator. It can be. We're looking for what we call a Malampati. Well, what is that? It's a big, long word. It sounds really fancy, right? So when you have a Malampati, I'm looking to see how big is the air hole in the back of your throat. Okay? I want to see how well do you breathe through your nose. Children, and this is one of the things I tell mothers with newborns, if the baby's mouth is open, just gently close the chin. We need to teach them to breathe through their nose. Yeah. And a lot of people don't realize that when they go to sleep, 3 to 4 hours into sleep, they're not breathing through their nose anymore.
Well, they're not deliberately. They're out.
Well, there's other reasons. And
drool. You get your mouth open. Yeah.
There's other reasons.
And having your mouth open when you sleep, it causes snoring too, right?
Well, snoring is one of the things that can disrupt the sleep, and sleeping partners, beds that have cats and dogs on them. You can be in a city where the sirens and the garbage trucks are waking you up. There's all kinds of things that create disruption, and you can have another partner that's snoring too.
Sure.
So I get that. I had a gentleman that sent his wife in who was quite upset to think that she's snoring really loudly, and when we tested her, the sleep physician sent back, she snores in big capital letters very loudly.
Women snore.
Yes, but that was like a flaw or something. And I'm like, this is not a personality flaw. This is something that we can fix. So as soon as we got her into a proper orthotic appliance, she didn't snore anymore. So husband was happy.
Oh, my goodness. How about kids? Can kids get sleep apnea?
Yes.
Really?
Yes. So one of the things that we know, and this is from Judy Owens,
Wasn't expecting that answer.
who heads up the Harvard sleep pediatric group, gave a lecture, and this was over 25 years ago, when she said they think that sudden infant death syndrome is sleep apnea in infancy, and they don't have the reflex to open their mouth to save their life. So we used to think it was the position that we put the baby down in. We had monitors that we developed for rooms and all that kind of thing. But yes, I get a lot of children with sleep apnea.
Folks, you've been listening to The Sleep Show. You can find them online at theburlingtondentist.com. Theburlingtondentist.com. Here, write this phone number down. More than that, use it. 860-673-7155. Let me slow down. I'll say it one more time. 860-673-7155. This is our pilot. It's our first show. And if you're as intrigued as I am, you're going to want to tune in each and every Saturday morning at this time for this show. We're just scratching the surface here, but we are delighted to have you with us. For Dr. Bethany Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next weekend, have a good one, everybody. So long.